All right, it's time for the daily briefing here on KLAM and KCDV, Monday, October the 12th, coming off of a not ideal weekend for Cordova or the state as a whole. Cordova was up to 12 active cases at one point. One of those is recovered, although as we'll hear, it sounds like we have the likelihood of some more appearing. Statewide, almost 500 new cases over the weekend, so this is definitely a thing in Alaska and in Cordova. And we're going to hear from not one doctor, but two, the usual wisdom and experience and knowledge of Dr. Sanders. And she will be introducing, and we'll meet for the first time on the radio here, our new physician, newest member of the medical team, Dr. Paul Gloe. So we hope you'll stick around and listen for that. Daily briefings in the 1, 5, and 8 p.m. hours on the radio, and youtube.com/Cordova TV if you need to be able to hear them online. Let's begin. So, Dr. Sanders, first, let's get your thoughts on what has been, I am thinking, our largest number of cases that we've had since the pandemic started, pretty much. What's your evaluation?
Yes, this is the largest weekend that we've had, and I think it has everybody paying attention and a little concerned. Over the last 2 weeks, we have identified a total of 12 cases here in Cordova, which that's a large number for our small community.
Yeah.
We have a number of tests pending right now, so we do expect to see that positive case number potentially go up in the next few days. We have had to start utilizing some send-out testing, so our results are taking a few days longer than they had previously taken. We still have rapid testing capabilities at both the Alanka Clinic and the hospital, but we are trying to preserve that stock for patients that are needing a test more urgently, and we are currently using send-outs for patients that are going to be in quarantine anyway and can wait for the results.
All right. Obviously, we'll preface this by saying we always have to be careful about privacy, but to the extent that you can let folks know, are the growing numbers of cases, do they seem to be expanding beyond those sort of one or two places where this kind of got started and moving into the broader community, or are you not seeing that kind of spread yet?
At this point, we're not seeing a large amount of spread that's not connected to some specific initial cases. That being said, we do know that coronavirus is a very elusive illness, and we see some patients that have zero symptoms and then the occasional patient that gets severely ill. So with that spectrum, it makes it hard to know and identify all of the cases.
Okay. And as far as the alert level, which as of today, or as of this recording at least, is still sitting at yellow at level 3, are we approaching any kind of a threshold where that might turn red, or are we still a ways from that?
Right now, we see that the hospitals, both here and in Anchorage, have good capacity. Our testing capacity is intact. Our contact tracing is intact, and we are able to get that contact tracing initiated in 24 hours. So we are not changing the level at this point. We feel that the cases that we are seeing, that we are going to be able to contain them, but we are paying close attention and will adjust that alert level if we need to. I've certainly been in close contact with the medical response team and with all of the physicians in town, as well as with the state, and have a call soon with the State Department of Epidemiology to make sure that everybody is in agreement with where we're at, that our mitigation plans are in place, and we still believe that those mitigation plans are working.
Okay. So we may see some more cases pop up on the dashboard, but it doesn't really sound, at least at this point, like it's going to change our status or what people should be doing for prevention, which primarily is what?
Well, the prevention strategy and mitigation strategies haven't changed. Just so everyone is aware, as we are having these, what we call observational studies, so as we're watching and seeing what's developing in the science regarding this illness, we are seeing that masks are showing to cut down the chance of both transmitting and catching the coronavirus. Some of the studies even indicate that a majority of viral particles are filtered out with a mask and maybe leading to less severe infections when people do contract the illness. So we still encourage masking when people are indoors and unable to social distance.
And then the crossing of bubbles, is that, because that sounded like for quite a number of weeks is sort of the main issue as far as large amounts of transmission is social gatherings, essentially.
Yeah, and we know that mixing of bubbles is something that's hard. The social isolation that this pandemic has brought out to everyone has been really challenging. I actually invited, and I'll maybe let you introduce him a little bit more, JR, but I invited Dr. Paul Gloe, who's a new physician with TCMC, to join me today, so he can talk a little bit about some of that, the social isolation and some of the challenges that we're seeing with this pandemic.
All right. Well, that moves us nicely to that phase of our conversation. Then, Dr. Gloe, let's meet you. Introduce yourself to the community a bit, if you would.
Yeah, hi. My name is Paul Gloe. I'm a physician who just moved to Cordova with my family. Really, really excited to be here. It's a beautiful place, and I think it's just going to be a great place for my family. I am family medicine trained. I consider myself to be a general practitioner, which is kind of, I like to practice that old-fashioned medicine where the doctor sees patients in clinic and ER in a hospital. That's a little bit about myself.
All right. Well, and you've had some interesting experiences with this virus, so maybe share what you can about that and the message that you have for the community is based on what you've gone through.
Yeah, well, it's been an interesting couple months for me. I actually got COVID about late to mid-July, and it was after we sold our home in Washington and were making our way to Bellingham, and I had some very mild cold symptoms, and it was just nagging at me. There's no way I'm going to get on a ferry with mild cold symptoms, and I need to get tested. And honestly, probably minimize it a little bit because of just my symptoms were quite mild. And so I did a test, and I was in a community that doesn't have the same testing capabilities, even though it was a much larger community, and there was a 5-day turnaround to get the test results back. So we were camping and isolating, and got the call from public health saying that I was positive for COVID. Fortunately, at that time I was symptom-free, but that put us into quite the spin. We were homeless. We didn't have a home, and now we needed to figure out how to quarantine as we're trying to move to Cordova, and feeling like you have the plague and not wanting to hurt anybody or put anyone at risk, especially the more vulnerable population. So then we tested everyone in my family, and both of my daughters tested positive. My wife did not test positive. So we were in this very, very long process of quarantine because their symptoms started after mine. And so my quarantine was 2 weeks, it's an isolation. It's not quarantine if you're positive. And then my daughters were starting after that. But we decided that we had the option, as we were homeless and being in a hotel provided by public health for the homeless population algorithm, if we wanted to separate our family so that we could get through our quarantine isolation process faster. Could see my wife's quarantine couldn't start until our isolation was done, which meant over 3 weeks of quarantine for her. And we decided we just couldn't be separated as a family. And so we remained in this isolation. We were homeless, and fortunately, some friends heard about our situation and allowed us to camp on their property. And we just camped for a couple of weeks and made the most of it. So.
Well, quite an adventure, and like you said, you took the words out of my mouth there. It sounds like you made the most of it, and it wasn't all chaos and bad memories, I suppose. So, what do you as you come to the community, how do you would you evaluate Cordova's response, and what would you most like Cordova to know based on your experience and your background?
I am very impressed by Cordova's response to the pandemic. When I first got to town, I was amazed to hear about the testing capacity here in the town. The testing capacity here in the town is honestly pretty much just unrivaled. You would never find this in a lower 48 where you could get these turnarounds on these tests and such. This generally, the systems are so overwhelmed that it's getting better. But Spokane was a 3 to 5 day turnaround, so that's great. One thing that I would like to speak about is it really is a very tough process to go through. We can make the most of the situation, but it's a very isolating experience for a person. And then, with the amount of concern about people getting very sick from this, you feel like you have the plague when you have it. And it's a really tough experience to go through when you are in isolation or quarantine. That is one thing I don't think as a nation we have addressed adequately with supporting those folks who are at home, and then supporting as a community them returning after public health has deemed them to be safe to return. There was weeks on end after I was safely out of quarantine that I still did not feel safe because I didn't want to hurt anyone going into stores. So it's a really long process for the people who have gone through being positive or being a close contact. So if any of those folks are listening right there, I think it'd be important to know that I would be happy to talk with them about the process and how you get through this, because it really is important for the community to stay open, keep our schools functioning, keep our businesses going to try and keep this at bay.
Yeah.
I hope that makes sense.
No, absolutely does. I appreciate it, because there's so many aspects to this, and some of the lines of conversation leap right out, and others are ones that you don't think about unless somebody brings it up. There's so many dimensions to it, and the benefit of your experience is great. So it doesn't sound like you have any qualms about interacting with people who need to interact. As far as, trying to understand this, how to cope, how to move forward, and so forth.
No, I think that's right. Mm-hmm.
Dr. Sanders, Dr. Gloe, thank you very much to both of you for your time, and I'm sure we'll be visiting again.
Great. Thank you.
Thank you.
Really good reminder there from Dr. Gloe, again, that, we think about a lot about the emotions and worries and so forth of those people trying to avoid catching the virus. And it can be easy to forget about the feelings and self-assessment that people have when they have had it and what they're going through, and not only concerns about their own long-term health, but the impact that they could have on others. So I always like it when Dr. Sanders reminds us, to maintain our distance and be compassionate. Good to hear from Dr. Paul Gloe, Dr. Hannah Sanders on today's briefing. Hope you got something out of it. These come your way on the radio in the 1, 5, and 8 p.m. hours on KLAM and KCDV. And we continue to archive them at youtube.com/Cordova TV. Let's be careful, press that curve down flat, get back down to 0 if we can, and we'll see you back here tomorrow for our next briefing on the Clam and the Eagle. Back to regular programming.